Hi, everyone. Welcome to RightSleep Sleep Chats. This is a series of short videos featuring RightSleep creator, Dr. Stasha Gominak, answering some of our frequently asked questions, as well as some others you may not have thought of to ask. We'll tackle one question at a time to help you improve your sleep and ultimately improve your health. We have been asked a lot of questions that start with, will RightSleep help with blank? And then they include a condition they have. So we are doing a series of sleep chats that address those questions. So Stasha, what does sleep have to do with stroke?
Hi, my name is Stasha Gominak. I'm a retired neurologist, and now I'm a sleep coach. And Heather and I are doing a series of short videos. The question about stroke has two parts to it. The first is, well, I've never had a stroke, but I sure wouldn't want to have one. So what should I do to prevent one, especially if I have some of the conditions that my doctor says increases my risk, such as high blood pressure, diabetes, high cholesterol. So the stroke risk factors that have been recognized for the last 50 years are in fact related to having a sleep disorder. And in my view, the sleep disorders are predominantly linked to having a low vitamin D and losing one's microbiome, the normal microbiome. That means to prevent stroke of many kinds, it's best to have the normal human microbiome and absolutely normal sleep. So you can think about using RightSleep to prevent stroke when you haven't had one. Now, the second situation is my relative or I just had a stroke, and I'm wondering if I can reduce my risk of further stroke, and can I improve my recovery from whatever neurologic residual problems I have after my stroke by having better sleep. And it is my belief that sleep is what actually allows us to heal any damage after stroke. The brain heals itself, and it is my belief that we heal our brain while we're in deep sleep. That means if you've had a stroke in the past, investigating your sleep is very important, and making that the sleep that you get be the optimal that you can have is how we heal in our best possible way. Strokes come in two general categories. One where the blood was cut off to a section of the brain. Cutting off the blood supply to the brain usually has risk factors that are about how I make a blood clot or why a blood vessel may close off. And those are all in various ways related to inflammation, and over time, they're related to acetylcholine levels, which links them back to D in the microbiome. The second type of stroke is where there's bleeding into the brain. So a blood vessel opens up and there's a blood clot in the brain, and that blood is taking up space and it's pushing on the brain tissue. So the brain tissue loses some of its blood supply and decreases its ability to function because of the pressure that's on it. In that circumstance, there are several conditions that can increase the risk of bleeding into the brain, but one of them is aneurysm. That's a name for a bulging of a blood vessel. So a blood vessel has several different layers. That means that it's elastic and it's able to put up with changes in pressure. Those elastic layers and all the other layers that keep the function of the artery perfect. So we've always told people when they had aneurysm that we found because of hemorrhage that they'd had that aneurysm since they were born. And I don't think that's actually true. I think we develop aneurysms frequently at a branch point of blood vessels, and we develop them because we are not healing all the layers of the artery every single night as we sleep. Also, those tissues are not made of Teflon. They're made of living material. One of the important parts of them are fibroblasts. Fibroblasts are the things that actually make the tissues hang together. They're little cells that attach one layer to another. The fibroblasts are covered with vitamin D receptors. So it's my observation that people who have aneurysms in their head or an aneurysm in their chest frequently have a profoundly low vitamin D. That means that they're in a dormancy phase all of the time, which means their message that they're getting from the low D is that we don't need to repair our arteries because we're dormant. We're supposed to be hibernating. That then links all of the types of strokes back to going indoors, having a low vitamin D, and losing your microbiome. There are multiple paths to different types of strokes, but in the background, they are all connected to, can I heal normally in sleep? Do I have the right messages being sent to my body to heal every tissue while I sleep so I can live a wonderful life until I'm 95?
All right. Well, thank you for explaining such a complicated and scary issue. All right. Well, thank you all for joining us, and please subscribe to the channel, like and share our videos. You can find more information about the Right Sleep program at drgominak.com. Remember, we see our doctor once a year because we heal our bodies every night. Until the next sleep chat, sleep well. Bye-bye.